the top three things to remember when you're setting up a skin cancer service within your practice, particularly within your general practice, there's probably three really key elements. Firstly is to have the right tools. So thankfully in skin cancer, you don't need too many tools, but you definitely have to have a dermatoscope, and you need to have that on your desk because skin cancer can be found on any patient at any time. So you need to make sure you got your own and it's charged and it's sitting on your desk. You need a cryo flask. You need to have some like a punch or a shave biopsy kit that's also in your rooms. So the key thing is just there's a small number of tools that you need, not many, that will allow you to be able to look at a skin cancer, then be able to take a biopsy to get an accurate diagnosis. Because whether you want to treat the patient or not, to getting to the diagnosis is the critical thing that we need to do. So that's the first thing, is the tools. The second thing that you need to know is you need to get the training, because ultimately, to be able to do skin cancer properly, you need some basic training. So definitely endoscopy, so at least you know what you're looking at, whether something's benign or suspicious, and then what to do with it. So should I punch it or shave it? So some very basic training. You don't need to do a lot, but just to get going, to start doing that process, because otherwise you are going to miss things that are potentially going to kill a patient. But also the other benefit is by doing the training, you now can put that piece of paper up on the wall and also promote to your patients that you have done postgraduate training in skin cancer and now can offer these services. And the third part realistically is going back then to actually letting patients know that you do have these skills and are happy to give them a skin check. So a lot of patients would like to get their skin checked, but obviously haven't thought about it, not sure that that service is available, might think that you have to refer them to a dermatologist, which obviously has got a time and cost inconvenience to the patient. So realistically, the best thing to do is then to let them know that, and you can do that in a couple of different ways. One is obviously you've got the piece of paper there. You can promote it obviously in your reception area that we now offer this service. The other thing is you've already got all the patient's pathology, all the skin cancer work you're ever going to want coming through the door anyway, through the standard patients that come through your practice. So you could ask your patients if they've got a personal history of skin cancer or a family history of skin cancer. And if they do have a personal or family history, then offer them, once again, a skin examination. You'll find that that's what they really would like to do. So letting your patients know is the third part to setting up a practice, a skin cancer practice in your practice. So one of the other important things about developing the tools and skills and letting patients know is that the key thing is that patients already have an expectation that the doctor probably does know how to diagnose and treat skin cancer. I mean, particularly in a country where 2/3 of the population are going to be diagnosed in their lifetime. But obviously, as we know, this is not taught in undergraduate level. So there is the need to do it because it is important. And patients, when they do show something to you, probably do expect you to actually know what a skin cancer or particular skin cancers look like. So that's why it's important to learn these skills.